Thank you for the introduction. Once again, I'm Dani. This is my colleague, Nyberg. We're going to go over some cow-calf vaccine protocols. Hopefully, it'll be a summary. So kind of an outline, we're going to talk about mature cows, both a spring program versus a fall program, as well as vaccines in replacement heifers, herd bulls, calves, and then why it's important to vaccinate. So the first program we're going to talk about is your mature cow spring program. So this is starting your vaccines prior to the bulls being turned out. The first vaccine I'm going to introduce real quickly is Bovishield Gold FP5VL5. And all of these letters, Bovishield Gold is a respiratory disease prevention, as well as it prevents against multiple types of abortions. The FP5 stands for fetal protection claim, which is the protection against IVR abortions and what's something called persistently infected calves with BVD. So they don't look sick, but they're constantly shedding this virus in your herd. So it's super important to identify those. And when you're giving this vaccine, it is it's called a modified live vaccine versus a killed vaccine. So it can have a bit of an inflammatory response in your cows and disrupt their normal cycling. So you need at least one cycle prior to the bulls being turned out. So that's why we say at least 4 weeks. And then in the fall at preg check, you'll give a Clostridial 8-way. A Clostridial vaccine is against Clostridial organisms that are normally found everywhere in the environment, but if your cows or calves get infected with these organisms, it can be fatal. And we also will advise giving Ivermectin, which most of you guys do, of one product or another. We roughly say after October 15th, assuming this is about the time of the first frost. So you want to wait to Ivermectin after the first frost. Ivermectin will kill your internal parasites, while the frost technically should kill your external parasites, stopping the whole cycle. And some of you may choose to give a pre-calving vaccine of scour guard. We mostly recommend these in heifers or if you're calving in very close quarters. Most of you guys are calving out in sections, so it's not a problem. But if you are running into any problems, that might be a good idea. So the spring program versus the fall. The fall is starting your vaccines when you're preg checking. So you can use Bovishield Gold FP5VL5 only if your cows have seen this vaccine, the same type and brand, within a year. So they cannot be pregnant when they first see it, or it will cause abortions. So if you're unsure of your cow's vaccine status, or if you're not really on top of your modified live program, please give a killed vaccine, which is called the Cattle Master. And then you'll also be giving your Clostridial 8-way vaccine and your Ivermectin, as well as if you decide to give scour guard pre-calving. So this has a lot of information going on, but what I'm trying to highlight is we know the risk periods for the two most important diseases that we're trying to prevent. It's IVR and BVD. And you can see that they're during these month periods. So we want the cow's immunity to be the highest during these high-risk periods. So this first circle, which if you pretend the whole back is black, that is if you vaccinate in the spring prior to the bulls coming out, your cow will have its highest immunity at these risk periods. In comparison, if you are vaccinating in the fall at preg check, which is your second circle here, the immunity is actually at one of the lowest periods because it tapers off during these high-risk periods. So basically, in summary, if you don't understand this, it's if you want the biggest bang for your buck, it's best to get on a modified live program starting pre-breeding.
So now we'll talk a bit about the replacement heifer protocol. So it's very similar to a starting off like essentially a spring program. So ideally, the heifers should get that Bovishield Gold FP5VL5 again 4 weeks before the bulls get turned out, just because of the same reason. It is produced an inflammatory response. It does mess with their cycle a bit, so we want them to have at least one cycle before they're exposed to the bulls, just to make sure they're at their kind of peak fertility when they get turned out. And then in the fall, the only thing different is we're going to boost that same vaccine in the fall just to kind of bump up that immunity. We'll also give them the Clostridial 8-way at that time, and then the Ivermectin, same as all the other protocols. And then pre-calving, like we kind of mentioned, it is a little bit more important in the heifers because their colostrum is usually of a poorer quality than those mature cows. So if you want a little bit more protection against scours in your calves, we do, encourage giving scour guard to those heifers. So if you follow this protocol, technically these heifers, after they've calved, when they are entering to the cow herd, they can either be put on a spring or a fall program. Since they've had it pre-breeding and they've had it in the fall, if you start them on a spring program, they'll have seen it, within the year because they got the booster in the fall. If you start them on a fall program, they'll have it in the fall. So that basically it's still a year there, so you should be covered if you go into either program. Just one last point on that one. If you are bringing in replacement heifers from off-farm, you are unsure of their vaccine history, do not give a modified live vaccine because, again, if it's the first time that they've seen it and they're pregnant, they will abort their calves. So if you don't have no idea, it's safest to go with the killed vaccine, which is the cattle master vaccine. The herd bull protocol, very similar to the mature cow protocol. They get the Bovie Shield Gold vaccine, they get the 8-way, and then you can vaccinate with fusel cards, so that's just a foot rot vaccine. If you had issues with foot rot in the past with your bulls, we do recommend giving the foot rot vaccine. Your first and second year bulls, so the first time that they see that vaccine, it technically does need to be boosted 3 weeks later, so that your young bulls do need to see that vaccine twice to be effective. And then again in the fall, ivermectin after October 15th. So for the calf processing protocol, most of us would be vaccinating during branding season. Ideally, these calves should be at least 6 weeks old when you're vaccinating. If they're under 6 weeks old, they're not going to get the full immune response due to something called maternal antibodies, but that's kind of a little bit difficult to explain. Basically, there's some interference that they're not going to get the full immunity if they're too young. So ideally, they should be at least 6 weeks old. So these first three options, so Pyramid, FP5 pre-response, Enforce 3, one-shot BBD, Bovie Shield Gold one-shot, they all cover the exact same stuff. There's just three different options that we offer. So this is going to be your respiratory viruses that cause BRD, and they also cover, the BVD virus, so diarrhea and preventing, mass outbreaks of bovine diarrhea. Very recently, there's been some new research that the second option, Enforce 3, one-shot BVD, so that's basically the same as all the other three, but they just split those two vaccines differently. That has shown to provide the most immunity out of all three options. So if you're looking at maybe changing your vaccine protocol, or if you just want some more information about that, feel free to talk to us after. It's kind of technically difficult to explain, but I'll try my best, and in a short time period, it's kind of hard to explain. So these calves should also get a Clostridial 8-way. If you're castrating or banding calves, ideally that 8-way should have a tetanus component in that because they are a bit higher risk for getting tetanus. We have a little note about meloxicam. So meloxicam is an anti-inflammatory pain medication. So if you're branding, castrating, or dehorning, these calves that get this anti-inflammatory, they just get up quicker, they start sucking quicker, they gain more weight than calves that don't. So if you haven't tried meloxicam, we really recommend it. It does make quite the difference, and it's really good bang for your buck that way. If you're on an implant program, you can also implant at this time as well. And then if you're planning on retaining some calves over winter or for your replacement herd, we do recommend boosting the respiratory component of the vaccine, so the Bovie Shield Gold or the Pyramid aspect. So what's really the point in all this vaccinating? So basically the two main reasons is you're preventing calf foot diseases in the calves, you're preventing the respiratory component of the BRD, so you're protecting against viruses. But the big one that we're kind of trying to prevent is the prevention of infectious abortion causes. So there's lots of causes of abortion. They can range from genetics, so problems during conception with the chromosomes and all that stuff. It can be environmental, so not getting enough nutrition, feeding moldy hay, cold stress, that can also cause abortion. But by far the most common causes of abortion in animals is an infectious cause. And 95% of abortions are caused by IBR and BVD, which are in the vaccines that we are recommending. So that's what we're really trying to prevent. And it can, be disastrous. So you can lose up to 60% of your calf crop with IBR abortions. It can range up that high. So, and this just is kind of talking about a difference. So we kind of talked about cattle master, which is the killed vaccine, versus the modified live, so the Bovie Shield Gold. So basically in general it's saying that modified live does provide better immunity than a killed vaccine, but a killed vaccine is better than not doing anything at all. So these are just the stats down there. You can kind of have a quick look at them later if you're interested, but it just basically says, unvaccinated, they have the virus in the blood, they have abortions, they have, PI calves, which we're trying to prevent. But when you vaccinate, you drastically reduce those numbers in your herd. So it kind of pays off, is what they're trying to prove. So, and that is the quick version of the vaccine protocol.
Yeah. Does anyone have any questions?
Yeah.
Hit me.
Can you, like, your heifer calves, can you just run them through right now while you got some time?